About 1 in 3 adults over 65 already has plaque building up in their arteries. And here's what most people don't realize. Those deposits started forming decades ago. The question isn't whether you have some degree of arterial plaque. At our age, you probably do. The real question? Whether you can slow it down, stabilize it, or maybe even reduce it. Because the research on this has changed pretty dramatically in just the past 2 years. I'm going to share what a 2024 Johns Hopkins review found about actual plaque reversal. And it's not what the supplement ads want you to believe. But it's also not as hopeless as you might think. The key is understanding the difference between regression and stabilization. That distinction could literally save your life. Let's start with what cardiologists actually mean when they talk about unclogging arteries. Because the word itself is kind of misleading. Think of arterial plaque like rust in an old pipe. Once calcium has deposited into those artery walls and hardened, it's permanent. You can't dissolve it with a supplement the way you'd use drain cleaner on a clog. A 2024 systematic review out of Johns Hopkins looked at 43 different plaque regression studies. Complete reversal, truly clearing out existing blockages, happened in only 8% of participants across all interventions combined. Now, before that sounds discouraging, here's the part that matters. What can change is the stability of that plaque, the formation of new deposits, and how flexible your arteries remain around the blockages you already have. And those changes are actually more important than total plaque volume when it comes to preventing heart attacks. Here's something your cardiologist might not have time to explain in a 15-minute appointment. A 2023 Johns Hopkins registry tracked heart attack patients over 70. They found that 67% of those heart attacks came from plaques blocking less than 50% of the artery, meaning the severity on your angiogram doesn't always predict your risk. A stable 40% blockage can be safer than an unstable 30% blockage that's prone to rupture. So when we talk about unclogging arteries naturally, what we're really talking about is stabilizing vulnerable plaque and slowing down progression. That's the honest version. The Cleveland Clinic published a 24-month study in 2023 that tracked 312 adults aged 55 to 75. Intensive lifestyle intervention, and I mean intensive, not casual changes, reduced arterial plaque volume by an average of 4.2%. The control group actually got worse, showing 1.8% progression. 4% reduction doesn't sound like much, but in cardiology terms, that's genuinely measurable. And more importantly, those participants showed improved plaque stability markers. Thicker fibrous caps, less inflammation around deposits, better artery flexibility. The Framingham Heart Study extension, published in 2024, followed nearly 5,000 people for over 30 years. What they found was pretty revealing. In adults over 70, arterial calcification correlated more strongly with inflammatory markers, specifically C-reactive protein levels, than with cholesterol alone. That's a shift from how we thought about this even 10 years ago. It's not just about lowering your LDL number. It's about reducing the inflammatory load that makes plaque unstable and prone to causing problems. Now, there's a 2024 Harvard study that caught my attention. Adults over 65 who consumed 30 grams or more of soluble fiber daily showed 18% lower arterial inflammation markers compared to those eating under 15 grams. The average American over 65 eats about 11 grams of fiber a day. That's a pretty significant gap. The mechanism is actually kind of fascinating. Fiber feeds specific gut bacteria that produce short-chain fatty acids, compounds that reduce inflammation throughout your whole cardiovascular system. This happens independently of any cholesterol-lowering effect. Let's talk about the 3 supplements that actually have some research behind them. Not the miracle claims, what the studies really show. Omega-3 fatty acids, specifically high-dose EPA, were studied in the Reduce It trial published in 2023. Participants taking 4 grams daily had a 25% reduction in cardiovascular events. But here's the key detail. The mechanism wasn't plaque reversal, it was plaque stabilization, making existing deposits less likely to rupture. That's still valuable, but it's not the same as melting away blockages, which is how some companies market fish oil. There's a catch with omega-3 supplements for our age group. A Mayo Clinic pharmacology study from 2023 found that only 31% of adults over 70 effectively absorb standard fish oil capsules. Reduced stomach acid, fewer digestive enzymes. It's just part of aging. The emulsified forms, or phospholipid-bound versions, showed about twice the uptake. CoQ10 is the second one with actual data. A 2023 Mayo Clinic study gave 200 milligrams daily to adults over 60 with mild atherosclerosis. Their flow-mediated dilation, that's a measure of how well arteries can flex and expand, improved by 1.7%. Statistically significant, though clinically modest. The interesting part? CoQ10 levels drop dramatically if you're on a statin, and a lot of us are. So there's a reasonable biochemical rationale for supplementation in that specific situation. Nattokinase is the third one people ask about. It's an enzyme from fermented soybeans that has genuine fibrinolytic activity, meaning it can help break down clots. A 2022 Japanese meta-analysis looked at 17 studies involving over 1,000 participants. The enzyme showed clot-dissolving effects comparable to low-dose aspirin in lab studies. But human trials revealed huge variability in how well people absorb it, anywhere from 12% to 68%, depending on individual gut enzyme production. If you're curious about it, the research-backed dose in most studies is 2,000 fibrinolytic units daily, and it needs to be taken away from meals. Look for brands that actually specify the FU measurement on the label. Here's something interesting. The top cardiology centers don't all agree on the best approach for our age group. Mayo Clinic emphasizes aggressive LDL lowering, getting that number under 70 milligrams per deciliter for high-risk patients. Cleveland Clinic puts equal weight on inflammation reduction through diet. Johns Hopkins focuses on full metabolic health, insulin sensitivity, weight, blood pressure, rather than optimizing any single marker. And Harvard's preventive cardiology group has started prioritizing gut microbiome health and fiber intake, which is relatively new. They're not contradicting each other, they're just emphasizing different pieces of a complex puzzle. But there's one thing every single major institution agrees on. Lifestyle intervention comes first. Diet, exercise, stress management, sleep quality. Supplements might complement that foundation, but they should never replace proven therapies if you already have documented heart disease. And this is important. Some geriatric cardiologists are actually questioning whether pushing LDL below 70 makes sense for otherwise healthy 80-year-olds. There's not a lot of outcome data in that age cohort, and aggressive treatment can sometimes increase frailty risks. It's one of those areas where the research hasn't caught up to the recommendations yet. Remember at the beginning when I mentioned that Johns Hopkins review about actual reversal rates? Here's the full picture. After age 70, arterial stiffness from calcium deposits becomes a bigger predictor of cardiovascular events than total plaque burden. That's why some 75-year-olds with moderate blockages have heart attacks, while some 80-year-olds with severe blockages remain stable for years. The flexibility of your arteries around the plaque matters more than the total percentage blocked. And that's actually where nattokinase and CoQ10 research is focused. Not on melting deposits, but on improving the function of the artery tissue itself. The Framingham data shows that arterial calcification starts on average at age 54, then accelerates after 65. By the time we're in our 70s, we've got decades of accumulated deposits. Expecting them to disappear in 6 months with a supplement? Just not realistic. But slowing the progression? Stabilizing what's already there? Reducing inflammation so new plaque forms more slowly? Those are achievable goals, and they make a real difference in outcomes. Okay, before we finish, I need to be clear about something. Everything in this video is for educational purposes only. It's not medical advice, and it's definitely not a substitute for talking to your own doctor. Your situation is unique. Your doctor knows your full medication list, your health history, your specific risk factors. Use this information as a starting point for that conversation, not as a replacement for it. If you've had a different experience with any of these interventions, or if your cardiologist gave you advice that contradicts something here, I'd genuinely be curious to hear about it in the comments. This is one of those areas where the research is still evolving. And look, heart disease is the leading cause of death in our age group. It's scary, but it's also one of the most studied conditions in modern medicine. We know more now than we ever have about how to manage it, how to slow it down, and how to live well despite it. Take care of yourself and talk to your doctor.